But I believe that Emile has a question and would like to ask it live. Over to Emile.
Yes, I'm here.
Yes, please ask your question. I think you have a question.
Thank you for giving me this opportunity. I address my questions to Dr. Moeti. The first one is a few weeks ago, the Minister of Public Health in Burundi said to wait until the end of the experimentation phase to order the vaccine, the COVID-19 vaccine. So the government of Burundi considers that the WHO and its partners are still testing vaccines. What do you think? And my second question is, Tanzania has about 60 million people, and Burundi has about 11 million people. What consequences can we expect in Tanzania and Burundi and in all the East African community region if these two countries continue to hesitate on the use of vaccines as well as on barrier gestures? Can we expect, for instance, collective immunity or chaos? Thank you.
Yes, I think the comment that vaccines are still being tested, first I'd like to precise it's not WHO that's testing vaccines. It is the scientific community working together, as I've just said in my response to the previous question, working together in partnership to develop and of course test vaccines. Testing vaccines is a very important step on the way to developing effective and safe vaccines. It is absolutely necessary. We cannot have vaccines being developed in a lab and then being deployed on populations. These tests are being done under the strictest scientific standards that have been accepted internationally to make sure that in the process of testing, people's lives are not endangered and we come out with the best performing products that can be then safely used to protect people, the population. This has been done at an unprecedentedly rapid rate based on research and development that had been going on in the past, looking at these types of viruses. So I would say it is a very important part, testing of developing vaccines. It has been done properly and well, and there are processes ongoing to then look at the data and apply what we call in WHO an emergency use listing of the use of these vaccines. All these steps have been undertaken to the best international standards. After that, once the vaccines have been given this regulatory approval for emergency use by WHO and by the regulatory authorities of countries, then they are safe to use. And what I then will say to the next part of your question is that we're encouraging these countries, Burundi, Tanzania, other countries that have yet to come on board, to do so and are committing to support them. Some have questions remaining about some of the requirements for them to be able to have access to the vaccines. And it's been said by many people before in our urging the international community to collaborate on ensuring that there is equitable access to vaccines. As long as there are pockets of populations that are not vaccinated, that puts at risk everyone. So it applies within the neighborhood in East Africa that you cited, that as long as there are countries that are remaining behind with their population not vaccinated as others are moving ahead, that's going to continue to constitute a risk. Particularly, I'd like to add, because the reality is that in African countries, although we would wish to have that ambition, it will not be possible to very rapidly acquire the vaccine supplies and within some months or even within this year, be able to reach the level of coverage of populations that will give population immunity. So this only then remains for us to continue to encourage and to urge these countries to know that their neighbors have used the information that's available internationally of how these vaccines were developed. And to add that there are many, many vaccine candidates in many countries that are being developed. There is a very meticulous process of ensuring that the highest standards are being applied before these vaccines are being licensed or listed for emergency use in countries. So I'd urge the countries to trust WHO, to trust the scientists and the international community, and to act as first good leaders, and the responsibility for their own populations, and also responsibility for the neighborhood. I think we have something called the International Health Regulations, which urges all countries to work hard to prevent the international spread of disease. And then this is something that we would encourage them to also take into account as they are signatories of the international health regulations.